Welcome to the second of 6 podcasts in the series Helping Patients and Caregivers Take the Next Step in Care, Medication Management. In this podcast, Medication Reconciliation, CMS NSICV 2011B, Susie Butler and Carol Levine will explain the importance of medication reconciliation for patients who transition from one care setting to another. This podcast is produced as a partnership between CMS and the United Hospital Fund's Next Step in Care campaign.
Let's start by looking at an issue that my organization has been helping people with for years, medication reconciliation. The simplest definition of medication reconciliation is comparing the medicine someone should be taking to what they're actually taking. Usually reconciliations will be done by a physician or a nurse when someone is admitted to a hospital or a long-term care facility or begins a home care plan of treatment. This is where a knowledgeable caregiver can be of great assistance. The caregiver's role is to make sure that nothing is missed. Caregivers can also answer questions about diet, exercise, allergies, and any history of adverse reactions. Most important, it's the caregiver's responsibility to ask questions like,
"What's this medicine for?
When should it be taken? Will it keep my mom up all night?
How is it given? Am I supposed to mix it or put it in a syringe?
Do I need to refrigerate this?
Will we need to schedule follow-up tests?
How long will Dad have to take this?
Are there any side effects to look out for? And what should we do if my husband has any problems?
Reconciliation doesn't sound too tough until you realize that the average person with Medicare will see 7.9 different physicians in the average year. If that person develops mild heart failure, the number of different physicians doubles to 15.9. If they are unlucky enough to progress to severe heart failure, the number nearly triples to 23.1. If they are admitted with a heart attack, they may see as many as 11 more doctors in the inpatient setting. A few years ago, when my father passed away and I realized that I needed to be a long-distance caregiver for my mom, medication reconciliation was one of the first things that I tackled.
Did you think you were taking more than you needed?
Mm-hmm.
Okay.
At that time I did.
When we came here to live where you're living now, we changed how many drugs you took, right? How many prescription drugs?
Mm-hmm.
Do you remember that?
Mm-hmm.
We went from a lot to a little, didn't we?
Mm-hmm.
Yeah. Well, I went back to the doctor, actually all 4 of the doctors in Kansas City, and asked them to compare or to tell me what you were taking and to tell me what each of those drugs were for.
Mom's new doctor was able to look at all the medication she was taking, including over-the-counter drugs like antacids, herbal supplements, and vitamins. In Mom's case, we were actually able to reduce the number of prescription drugs she took.
not everyone is as lucky as Susie's mom, but even if you don't discontinue a lot of medications, reconciliation minimizes the risk of duplication, omission, or other error. It creates a comprehensive medication list that can be shared with new doctors or used to price drug plans, and serves as a roadmap for medication management.
Just remember, it's a roadmap that has to be updated. Sometimes it's just as important to know why and when someone stopped taking a medication as it is to know what they take now. I'm used to working with computers, so I just have a spreadsheet for Mom's medication, and when I take her to a new doctor, I print out a copy. Mom also keeps a copy in an envelope labeled ICE, in case of emergency, in her purse. If you would rather have a hard copy record, you can call 1-800-MEDICARE and an operator will take down your medications and mail you a copy. Most hospital discharge coordinators or providers using electronic health records can also print out a list of patient medications as a report. There are also sites on the web where you can print a medication record form that you can fill out by hand.
One site to visit is www.nextstepincare.org. On the left side of the page, follow the link for guides and checklists for family caregivers, and then the link for more information about the medication management form. This is the form that we suggest people use to do their medication reconciliation and management. The form is available in English, Spanish, Chinese, and Russian. You can fill it out, save it on your computer, or you can ask a friend or neighbor to print out a paper version and fill it out by hand.
Do you know what medication reconciliation means? What role health professionals and family caregivers play in reconciliation? What problems can be identified through medication reconciliation? Thank you for listening to this CMS podcast. You may also be interested in the other podcasts in the Next Step in Care series: medication risks during transitions in care, medication management, monitoring compliance, help with medication costs, and caregivers and medication management. The information you heard was correct as of the date it was recorded, July 28, 2011. This podcast isn't a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings. Thanks for listening.